Technical Veterinary Learning TVL channel. Founded and produced by Professor Ahmed Mamdouh El Sharif, Professor of Epidemiology and Infectious Diseases of Animals, the ex-head of Department of Veterinary Medicine, the ex-vice dean of Faculty of Veterinary Medicine, Bani Suef University. Animal infectious diseases caused by Clostridium species toxins. Pulpy kidney disease or overeating disease or Clostridium perfringens type D infection. Pulpy kidney is an acute toxemic infectious disease of all ruminants, characterized by short course of the disease, with diarrhea, with convulsions and sudden deaths. Epidemiology. Pathogenic risk factor is the Clostridium perfringens type D toxins, which are major and minor epsilon toxin. Geographical distribution. Pulpy kidney disease is a wide world distributed disease, especially in heavy producing countries. Animal risk factor. Lambs on a well-fed heavy milking ewes are susceptible. It is a disease of ruminants, especially in lambs and veal calves, rarely in adult cattle, deer, and camels. It is also noticeable in equines. Clinical cases reach to 10% throughout the flock, while case fatality reach to 100%. Environmental risk factor. Time of onset is during diet changes. Grazing directly post-training. Most affected ruminants are fed on a highly nutritious diet that high in protein, starch, and or sugar. Transmission of this disease is noticeable through ingestion of spores. Pathogenesis. Clostridium perfringens type D spores multiplied and it changed into vegetative form that produce toxins. These toxins are epsilon, major, and minor protoxin. These toxins it changed into active lethal necrotizing toxin action, which increase intestinal permeability, so leads to more absorption of these toxins that reach to the blood, causing toxemia. In the GIT, they cause profuse mucoid diarrhea, while in central nervous system causing depression. When come out through glomeruli of the kidney cause renal damage, and in the liver, they stimulate production of CAMP, which break down of glycogen into glucose. All these signs lead to death due to toxemia and nervous shock. Clinical picture. In lambs may be yawing, dullness, depression, lethargy, and stop suckling is noted before death. This disease showing very short course, 2 to 12 hours, and death without any previous signs. Cases that survive for few hours may show green, pasty diarrhea, staggering gait, recumbency, and severe colonic convulsions. Death post a short period of coma or during convulsion were noted. Clinical picture of adult sheep. They survive for 24 hours, showing staggering gait, knuckling, salivation, champing on empty jaw, abdominal pain, irregular, shallow and rapid respiration, bloating and diarrhea, muscular tremors, convulsions, and grinding on teeth. After 24 hours, death is with 100%. Post-mortem picture. Good body condition of dead animal, rapid decomposition of the carcass, filled GIT with grains and or all concentrates, excess of clear straw color and thoracic fluid that clotted when contact with air due to presence of fibrin with large amount. Pulpy kidney is the characteristic findings. Liver is dark and congested. Liquefied brain in sheep that died after a long time of clinical symptoms. Longitudinal section of the kidney showing cotton aspect after removal of the capsule due to the action of toxins. The external aspect of the kidney showing swelling of them. Hemorrhages in the intestine of a calf that died from pulpy kidney. Pulpy kidney have to be differentiated in case of sudden deaths in lambs with the following diseases: pasteurellosis, hypocalcemia and hypomagnesemia, polio, encephalomalacia, acute ruminal impaction, other septicemic diseases. In case of sudden death in sheep, pulpy kidney have to be differentiated from rabies, acute lead poisoning, and pregnancy toxemia. We keeping you on the right track, so please subscribe the channel to reach to the most newest knowledge about the epidemiology and different infectious diseases of different species of animals. See you later.